Right, let's now discuss this further. We're joined via Zoom by Professor Jacobson, who is president of the Southern African Society of Thrombosis and Hemostasis. Well, good afternoon to you and welcome.
Thank you very much, Colin.
Well, South Africa has voluntarily suspended the Johnson & Johnson vaccine rollout until the causal relationship between the development of clots and the Johnson & Johnson vaccine is sufficiently interrogated. What's your take on that?
So I think that, firstly, I'll make the point is that thrombosis, that COVID-19 itself is a huge cause of thrombosis. And the fact that these clots are occurring in vaccines is a very, very rare condition. It's a very, very rare condition. I think it is causally related. I think there is definitely a cause but it is so rare that one shouldn't really be concerned. And I think that I understand that the minister was forced to do this position. I'm of opinion that it should be stopped and reversed as soon as possible, and we should go back to vaccinations because it's so rare. To give you an example, the condition that is occurring of these clotting is a very similar condition to a thing called heparin-induced thrombocytopenia, which we see occasionally, very, very rarely, where patients get heparin for bypass surgery or for clots in their legs or clots in their lungs, and then they develop a rare condition where they damage their platelet count, and they'll end up losing their limbs and even their lives. We haven't banned heparin. We use heparin every day. Because it's such a rare condition, and because heparin, the risk-benefit ratio is such that every time you give meds a drug, there's always a benefit and a risk. And does the benefit outweigh the risk? Definitely the benefit outweighs the risk. COVID itself is a huge, huge cause of thrombosis. And we need to be very aware that that is a problem, that we need to make quite sure that we don't chuck out the baby with the bathwater. That's a very important issue that we can carry on our vaccinations as soon as possible.
So, Prof, I'd like us to just simplify our discussion now for our viewers. When we're talking about thrombosis, we've been talking about blood clots. Now we are saying thrombosis. What are we talking about?
So thrombosis means blood clot. So one generally gets blood clots and one of three things happen. Either there's too little blood flow, the blood is static, or there's a damage to the lining of the blood vessel, or there's a change in the consistency of the blood. Those three things, first described by Virchow more than 150 years ago, is what causes thrombosis. With the vaccination, we're seeing something completely new, which has never really been described before, that the patients drop their platelet count because they get a reaction which causes the platelets to aggregate and one to get a blood clot forming in abnormal sites. So the one site that gets caused is in the brain, and the other site that gets caused is in the abdomen. And these are rare causes, very, very rare, and one needs to be aware that COVID itself causes clots in the lungs, causes clots in the legs, and can cause clots in the brain in its own right. So your risk of dying from COVID and clotting is at least 30,000 times greater, minimally 30,000 times greater than from getting the vaccine. So one needs to be aware that it's much safer to get the vaccine and not get COVID than to get the vaccine and get a clot, because the COVID itself is a much, much greater cause of thrombosis. And I think my real concern is that a lot of people in the street are now not going to have their vaccination because they're worried about getting a clot, and the risk to getting a clot is much greater by getting COVID. So my plea to your viewers out there is, as soon as the vaccination program starts to roll out for the general public, you should go for it. There are a lot of even doctors that haven't taken it because they're being silly and they don't really understand the science. If you ask any of the academic doctors who are managing COVID, and I'm on the front line managing COVID, that this disease is a terrible disease and one needs to be vaccinated. And all the people I know, true academics, have been vaccinated. My staff's been vaccinated. So there's no doubt that the proof of the pudding is in the eating. If I thought it was dangerous and I was worried about myself getting a clot from the vaccination, I would never have gone for the vaccination. I strongly believe that I went for the vaccination, all my staff went for the vaccination. We need to convince the public out there that vaccinations are a good thing. Vaccines have improved the longevity and the quality and the quantity of life enormously. And we need to be out there promulgating the use of vaccination as soon as possible.
The strangest thing about the Johnson & Johnson vaccine is that these after effects of blood clots are only found in women. How do you explain that in as far as vaccinating people not according to gender, but the end result now comes with side effects only affecting women and not men?
Well, first of all, in the one study it was only women, but in the other AstraZeneca men as well. And it's not only women, so I think it's more commonly in women than in men, because women have a slightly higher thrombotic risk than men. But it's very, very rare. It's seriously, seriously rare. 5 cases or 6 cases in millions and millions of people. Your chance of being hit by a bus crossing the road is much, much higher. You've got to be silly not to take it. It's such a rare thing, very, very rare. And to try and say, well, we're not going to vaccinate young women, it's nonsense. It's absolute nonsense. These people, I've seen young people die from COVID. Young people die from COVID. It's not limited to older people. So if you can be vaccinated, my plea is out there to go and get vaccinated.
Prof, please give us a microscopic view of a blood clot. How does it happen when the vaccine enters one's bloodstream? What is really causing this snowball effect?
So we don't really understand what's happening. But what happens is that you develop an antibody against one of a certain factor which lines your platelets. Platelets are originally called blood dust. They're little things that float around your body, and they contain phospholipids, and they provide the surface where the blood clots can occur. And so they increase the surface area for blood clot for all the coagulation factors to work on. And you develop an antibody from the vaccination, which is very, very rare. And this antibody then binds the platelets and activates them and causes you to get a clot.
Please tell us about the relationship between a blood clot and pulmonary embolism.
So pulmonary embolism is a blood clot. So it is a blood clot. So what happens with classical pulmonary embolism, you develop a blood clot in the leg, or in the inferior vena cava, but a blood clot in your leg, so-called deep vein thrombosis. That blood clot then breaks off and travels upwards via the heart to the first narrowing, and the first narrowing will be in the lungs, and that's called a pulmonary embolism. With COVID, you get that occurring, but more importantly, you also get occurring of microthrombi, small clots occurring in the alveolus, little air sacs in the lung, which is very, very unusual, which occurs with COVID. And we've seen that a lot of that now with COVID, and these can be fatal and will end up killing the patients.
So then, do we have our vaccination rollout program in jeopardy here, where we are paying 140 rands for one dose, non-refundable, and also where does it really take us in as far as ordering Pfizer as well? Are we not bringing about confusion in the process?
No, I agree. It looks like there's confusion. I think the J&J vaccine is a very good vaccine. It's been shown to be effective against our variant. The incidence of thrombosis is minimal, absolutely minimal, compared to the incidence of thrombosis that's occurring with patients who are getting COVID. So I don't see any problem with the J&J vaccine. I've had the J&J vaccine. I think it is a very, very good vaccine. And I'm pleading to your viewers, as soon as if it's available, to go and to get vaccinated as soon as possible.
All right, sir. Thank you so much for making time to speak to us. We really, really appreciate it. And we hope to speak to you again soon to clarify the issue of blood clots and whether or not South Africa will resume the use of the Johnson & Johnson vaccine.